is very good. The chairman for this institution is someone who I've known for very close to 3 decades, and he is um, a veteran public health physician and a renowned medical doctor. He has served um, in that capacity for a very long time, and now he's the chief medical officer. Ladies and gentlemen, let me take this opportunity to introduce to you Dr. Amara Jambala.
Members of the First State. Thank you very much, Mr. Thomas, for that brief introduction. Ladies and gentlemen, we are about to move into a new paradigm. We had started this jump several years ago when we came together in partnership with our development partners such as CDC, USAID, WHO, and so many other partners, but mainly those are the big ones. We set about to sort of produce a document that will be or stand the test of time, whereby partners who come into country can look at it and know the sort of direction that we want to go in regards to health security. You see, the National Action Plan, which we have developed over the last 2 years, is a testimony of partnership. It depicts and clearly signifies what it means to come together within one umbrella and answer a call for us human beings to survive by overcoming diseases of potential problems. We all know when we had our outbreak, 2014, and even preceding that, we had the cholera outbreak in 2012, where we had over 23,000 cases of cholera and about 299 deaths. It makes the country ill prepared to respond to issues of public health emergency. I mean, when the Ebola came, the picture was the same, and that is why the devastation that occurred with the Ebola, we said no more should the country be in such a state for us to, for problems to overcome or solve. In fact, all of you know, at one point or the other, there was panic, whereby the response was taken away from the ministry and given elsewhere. But again, the ministry continued to support technically, and we did. Out of the Ebola response, I will tell you, we have created a cohort of experts within the country. We now have within the country people who are ready at any time a problem comes, they are ready to move up front. We have a training exercise. We have a field epidemiology training program that has produced many cohorts. It created enthusiasm for surveillance. Thus, we now have a responsive team within the ministry that can answer to the call of response. We have labs. Labs is not where it should be, but we have colleagues who have been trained in laboratory work and who are able to diagnose strange pathogens that may come into our remit. We now have within the EOC, I know, ladies and gentlemen, everyone knows the EOC at the Cochrane. Within the EOC, that is where partnership at its optimal level occurs. No more do we have the haphazard way of coordination. When an incident occurs, the ministry, through the Honorable Minister, triggers a response mechanism. All of us move into the EOC, thus making it an environment that where we can take action. And this is where we have put into the document our national action plans. The action plans which says the activities that we should do in times of need. No panic, just the idea and the cost. We have costed the action plan. Sierra Leone happens to be among the first 10 countries that we've gone through that exercise, and we have shown many other countries the way to go about in doing it. We have taken what it means, community engagement, leading to community mobilization. We are optimal level on that. Our communities are ready as and when we move them to be. We have this document. Next week, next tomorrow, His Excellency will be launching this document. It is a document that each and every Sierra Leonean should be proud to be part of. As a ministry, with our leadership, the Honorable Minister, we are able to get the buy-in from other sectors, such as the agri sector, wildlife, the environment sector, and every other sector. Every one of us, we came together and was very, very pushful in us signing this document. We have this document. We are about to launch it. It is a document that will give you graphic ways to act in times of emergencies. Not like the last time when you all saw how uncoordinated we were, how ill prepared we were, but we say the dawn has come whereby we are better prepared. We can make things work. Let us be proud of our home resource, in that we have people in this country who can make things happen. We have colleagues, we have young men who are ready to step up to the bat and step up to the plate and bat. We have within the Ministry of Health a responsive leadership and a responsive team. We are here today just to give you an insight into what we are about to do within the next 2-3 days. After that, the world will judge us, and I'm sure when they do, Sierra Leone will be in a better place. So ladies and gentlemen, welcome to this press briefing, whereby we'll give you, shots of the document that we are about to make, the document that we have produced, a Sierra Leone document. So thank you, and Honorable Minister is here to, spur us. He's been an inspiration. When he comes into this equation with his own attributes and style of leadership, whereby the academia is not far away, and he pushes us to excel. He has added value to what we are doing, and by and large, the entire document and the entire ministry is a better place as we move along. So let me say thank you for coming, and we will go through this. We are ready for your questions, and whatever comes our way. I have my colleagues. Dr. Vandi is here, and of course the Deputy Chief Medical Officer is Public Health Dr. Titi Samba is also here. We are ready to answer the questions that may have been a problem to you, that we can unfold them here today. So thank you, ladies and gentlemen. Thank you. Good. As I was saying, to every equation, as you know, the Honorable Minister is a chemist. In chemistry, A plus B equal to something, the product. The minister comes into the equation of the ministry and has made sure that he's a catalyst. And we know chemistry. When you're a catalyst, you make things happen positively. He is here to give us support and make sure that this document is owned by all of us, be it the Sierra Leone Public Health Agency or Public Health EOC or the Ministry of Health. So, Honorable Minister, over to you, sir. Welcome, sir.
Well, let me join you by standing up as well.
Good afternoon all.
Good afternoon.
This is a press briefing. The key word there is briefing, as the activity itself will take place on Thursday, wherein we launch the National Action Plan for Health Security. However, this activity is for you to have a better insight into what we are going to do, so you can help disseminate the information to the general public. We do not think during the activity itself, the launching program, that you would be able to capture all the tenets of it. So we are giving you a front seat in this program in which you can ask as many questions as possible. You know, we are all citizens of Sierra Leone. We are part of 7 million people. We are divided into 16 districts and the western area and urban. Each of these districts would have anything between 400,000 people, like Cambia, to 600,000 people, like Bo. 600,000 people. What you're saying is that your whole existence is within these confines. Your schooling, your feeding, your housing, and what you aspire for in life every day, what you want to attain. Whatever goes wrong health-wise brings all of us cascading down. Whatever emergency that occurs affects your education, affects your economic situation, affects every single thing about you. Let us take Sierra Leone as it stands. With our rapid urbanization, people move towards urban settings, be it within Bo town rather than Bo district, or within Freetown rather than the western area. You now see what high population can do, and you get environmental degradation. We experienced the mudslide. In 24 hours, we lost over 1,000 people. Something that can happen in a whole year war. 1,000 people in one day, highlighting to you what environmental degradation could do. But that is the visible part. What are the quieter ones? The diseases you get that are waterborne, that continue to plague you through the years. We are witnessing global warming. We are witnessing heavy rainfall in Sierra Leone. We are witnessing major floodings now. What is happening with us with regards to waterborne diseases? That is what some of this thing is being presented in this document. Take the next step. If in fact economically you find it difficult to manage and handle yourself, you find it even more difficult to handle your pets. Stray dogs are on the increase. You now know that animal bite is a major problem in Sierra Leone, indicating rabies could also be a major disease issue in the country. How are we going to position ourselves for such emergencies? Check the boundaries. Check Guinea. The last time in Sunkunia, Demdebilia, there were worries that ruminants, sheep, goats, die in a few days. Extended stomach, watery nose. Grave doubts about what this could be. There was even thought process that this could be anthrax. Do you know what that could do to Sierra Leone if it was anthrax? You require laboratories that can do diagnosis almost immediately to do that. What is the type of lab you need to have in the country, and why should we have it? That is the type of thing you would have in this document. Let me go further. We witnessed Ebola. Sierra Leone had the highest economic growth rate in Africa, 2013, 2014. Then we were exposed to the Ebola scourge. Practical examples. We lost African Minerals. We lost several other companies. Rather than increase growth rate, rather than prosperity, we went to austerity. One disease outcome. 3 years, we lost 4,000 people. 3 years. But environmental degradation, as the mod slide, we lost 1,000 in 24 hours. 1 day. In the Ebola, we lost 3,000 in 3 years. But for a country that has been struggling for health services, you lost close to 300 health personnel, doctors, nurses, CHOs. One disease. Are we going to stay like that and wait for the next outcome? What this document is saying, that the answer is no. What this document is saying, that we are going to prepare ourselves to know what steps we are going to take for whatever outcome. In life, however, as long as there is Allah, you will not be able to be 100% prepared. But we want the rest of the Sahrawi people to be comfortable and confident that the Ministry of Health 2019 is not the Ministry of Health 2014. That the Ministry of Health 2019 now has scientific laboratories that even search for the diseases before it comes out. We now know that there are certain bats that house the Ebola virus. The case fatality ratio of Ebola is 41%. But there's another hemorrhagic fever, another disease that is called the Marburg, with a case fatality of 91%. For every 100 affected, 90 will die. It exists in this country. It is within certain bats. They call them Egyptian rosette bats. In Mombali, in Moyamba, in caves. So, if you want to make an outing, and you say, let me take my girlfriend to the cave, and you go destabilize the bats, you now see what potential problems we have. What I'm trying to bring to you here is that the Ministry of Health cannot provide health without linking with the Environmental Agency and the Ministry of Lands and Environment. The Ministry of Health cannot provide health without linking with the Ministry of Agriculture. So what we now have is called One Health. It is that One Health that we have, although we take the lead, but we recognize that we do not have it all. Because zoonotics are things that move from animals to humans. And things that move from animals to humans can kill you much faster than things that stay with humans. This action plan is now saying we can do well, free quality education. You can be doing well. The Minister of Finance can do well, stabilize the economy. But all of those will not help us if we do not stand guard for health emergencies. Ladies and gentlemen, we are inviting you to come on Thursday to help us in disseminating the information that we are all each other's keeper. It is for you to know what to do when you see your chicken at home starts to behave certain way, for you to know what to do. When your dog at home starts to behave certain way, for you to know what to do. When your sheep, if you are a fool like me at Binti, when your sheep starts to do things, for you to know what to do. Because each and every one of us is each other's keeper. I thank you very much.
We actually had Ebola when we had issues with our health system. The health system was weak, fragile, and so Ebola was able to tend to grow. After Ebola, we are in the process of reconstituting the health system. We normally call it health system strengthening, so that it becomes more robust, responsive, and resilient, addressing the health needs. We didn't have an EOC from which to coordinate an outbreak. Now we have an EOC. Of course, you all know that it is on Wikis Road, close to the military base, headquarters. We also did not have the contingent of staff required for various disciplines. You will need laboratory specialists, you will need some officers, you will need epidemiologists, you will need community motivators and different cadres of staff. So we now have been able to train. IPC standards were also very low, and we are working along those fronts to make sure that we have, first of all, the human resource required, the competencies required so that we are able, and of course now we have a well-defined coordination mechanism so that in event of an outbreak, we are able to coordinate it. And the man who spearheads that is Dr. Van Didia, who is the Director of Health Security and Emergencies. Because I supervise him and the CMO supervises all of us, and we report to the minister as and when needed. I don't want to go too much into that, but just to summarize, I just want to have.
Okay. What type of diseases?
Yes, good afternoon, ladies and gentlemen. I'm Dr. Vandi, I'm the Director for Health Security and Emergencies. We are looking at a spectrum of diseases, but particularly those that have public health interest, that can have the capacity to cause epidemics, outbreaks, pandemics. They are the ones we are focusing on. Like the EVD, the VHFs. VHFs are viral hemorrhagic fevers, like Lassa fever, the Marburg, the Ebola, Bombardier virus. These are the VHFs. We are also looking at measles, rubella for childhood illnesses. These are the ones we are looking for. Meningitis, yellow fever, dengue fever. These are the type of diseases we are looking for. In this case, there are a lot in the hospitals, the clinical setting, but those that they have the capacity to cause outbreaks and epidemics and pandemics are the ones we are focusing on here. So the lab we are talking about public health lab. We have clinical lab, we have public health lab. The one minister was referring to. We have clinical lab, we have public health lab. So all the 15 diseases of priority with public health interest, we have people who are trained to detect them in the laboratory. The diagnostic algorithm is there, they are trained on it, they have the equipment, they have the reagents to test for them, 15 of them. There are a lot, as I said, in the hospitals. These are not the one we are looking for. We are looking for those that have the potential to cause outbreaks, epidemics, and pandemics.
Good. Thank you very much. The question about money. Yes. You see, with the advent of the Ebola, I remember when we 2014, when the first case of Ebola came, when we asked WHO if they had money, they only could give us $20,000. This is the truth, naked truth. There was no money, and there was no money going anywhere. But now the good thing is, when you make these plans, you tend to fulfill international criteria for you to be financed. We have now a standing order with the World Bank that predisposes any funds within country. If the minute myself or the CMO declares an emergency, or from the state house the president declares a state of disaster, funds are released. Those funds are made available to the health sector with immediate effect. But that can only come about if, when partners see that you have a viable plan, you have a working document. You know, you just don't go to the bank without a checkbook. You say, I want to withdraw money. How? Our plan, the plan that we are about to launch, is our own checkbook to resources, and it's also our checkbook to go to the Ministry of Finance and say, look, you need occasionally to be setting aside resources for times of emergency. It was in this room after the 2012-2013 outbreak of cholera. We came here and said, listen, let us put money aside for emergencies, but you can never know. But you know, this is why we should not encourage the unbelieving Thomases among us. It was here. Somebody sat there and made that remark here. and said, let us put money aside. You don't know the day emergencies will come. And they say, no, when emergencies come, we will react. The usual Sierra Leone way. And Ebola came. He said, I'll give you a mightier outbreak than ever. We did not have a single cent. So, access to resources begin with a very good plan. And the plan is what we have at hand for us, not only to access our own resources, but also to access partners' resources. A partner may come, say, look, if I'm looking at community mobilization, community engagement, and you say you need X, Y, Z, I can do that. So the plan is for resource mobilization in real time. They ask the question which, I don't know, Harold is not here for the community. Yes. The issue of how do we mobilize? You know, now it's not about community mobilization. It's about community engagement. Engagement being the first part. Nobody will come to your house and start going directly to your house without not greeting you. The engagement aspect is the greeting, right? You greet someone, you know what the person wants, before ever you go in and mobilize that community. So this is what we're saying. The science of community mobilization has changed. It is now a science of engaging, repeated engaging. We saw during the outbreak, people came from afar. They went to Poloko there, started talking. Oh, can you talk in English to someone who speaks Timini? And you want to talk through a third person. Are they going to understand? You have not greeted the person well, so you have not started the engagement process. So now we have turned community engagement to a science, right? And it is now measurable. In other words, it's telling you, if we sit here and we sensitize X number of people, the chance of the message reaching to those X number of outlets is by far. If we only take, let's say, Standard Times here, one outlet, are we going to get our message to the far end? No, we take several. That is why you are here. We take several because it's like a football game. When someone shouts foul, you say it's a goal. Right? Because you are looking from a different angle, and we are looking from another angle. So we all see the same, we see the different perspectives, and that's what engagement is all about.